And as kumbaya as that might sound, I think it's really important to get that message out there, because without these services, without this work, I think it really leaves a lot of people in need. So with that, we'll talk a little bit about state initiatives, and I'll turn this slide over to Christy.
All right, thanks, Eric. Thanks, Jody. It's a pleasure to be here with you all today. And it's exciting to see all of the different entities that are represented here. Some of your names I haven't seen, or faces I haven't seen in quite some time. So it's a joy to be here virtually with you. One state initiative that we are very excited about, we're in year 2 of this, is House Bill 373 of the 2019 legislative session. So within this House bill, there was a $26 million allotment for ongoing funds to support our local schools and school districts in hiring or contracting with qualified professionals. And so you can see a list. This is not a comprehensive list, but a very brief summary of all of the different positions that can be hired or contracted with. So school counselor, other counselor, school psychologist, other psychologist, social worker or school social worker, school nurse, and then of course the many different contracted services that are available, including telehealth. And so that was a very exciting thing to happen a couple of years ago. We've seen tremendous growth in our schools, and that really addressed one of the hardest things that we see with mental health, and that's access to care. And so that's, if you have any questions about that, again, just to repeat what Eric said, this is meant to be a conversation. We want this presentation to be useful to you. So please feel free to pop something in the chat or raise your hand, and we'll be happy to discuss these things as we go. So next slide. Thanks, Eric.
Yeah, perfect. So mental health screening. So Christy and I will be talking about this a little bit together. So with mental health screening, this is really interesting. It came out of House Bill 323 that Christy mentioned already, out of the 2020 session. Within this is really interesting. This has been an entirely collaborative project between USBE and the Division of Substance Abuse and Mental Health. And the benefit there is we've been able to utilize both of our systems' expertises in order to ensure that we're looking at what's going to be best and most appropriate for schools. So within this bill, we really wanted to talk a little bit about what it means. And Christy, if you want to talk a little bit about the specifics, and I can maybe talk about the aspect of what a mental health screener is, so that way we're on the same page.
Yeah, absolutely. So this was also very exciting, especially considering the growth in the area of relationship and conversations with school-based mental health just in the last couple of years. So for us to move into that realm where we can do mental health screening on a larger scale, so this is meant to be a little bit more universal in nature, was really exciting. And so the mental health screening bill, House Bill 323, it set forth a directive for USBE to work closely with the Division of Substance Abuse and Mental Health, and to present a list of approved screening tools that can be used in schools. And that comprehensive list was one that was approved by the board. It's now posted on the website, so feel free to go surf through that if you're interested. And also it had USBE work with DSAMA to create a list of mental health conditions for which schools could screen for. And so there was 3 conditions that were finally approved for, and that would be depression, suicide, ideation, and anxiety. And so that's kind of brief summary on what happened there. Again, it's all up on the website if you want a little more information, or again, feel free to ask some questions. Eric?
And I'll just add to this. When it comes to the mental health screening process, when it comes to looking at these tools, we spent, I wish this was an exaggeration, but hundreds of hours going through this and ensuring that we weren't just grabbing things that were randomly vetted on your neighbor's website or blog or something like that. We wanted to ensure that this is really based on evidence-based programming, evidence-based assessment tools and screening tools. And really the goal here was to also have a process that allows for alternative tools to be vetted if necessary. So there's also that process. And more of that information can obviously be seen on the website. Regarding the screeners, I think one of the best aspects of this, though, has been the availability to provide screening tools to more individuals and more kids. One of the areas that I think is always challenging is getting that first foot in the door. And a screener is just the perfect opportunity. And where schools already provide opportunities for screening for things like vision and hearing, I think it makes perfect sense to have this, as that we're talking about our whole health. So just know that there was a lot of time and effort that went into this, and we're really happy with where the list is, but there's always ways to improve it. And we are continuously working together on this issue. So
just one more thing on this, Eric, before you move on. The mental health screening, as part of the legislation, a training is required for those that are administering a screening. And so it's done intentionally in a way with that training, that people understand where mental health screening fits and the tier of interventions and identification of students that may be at risk or showing symptoms. And so that element has also been firmly set in place to make sure that screening is implemented in the right way.
absolutely. Thank you very much, Christy.
Thank you.
The next thing that we wanted to talk about is House Bill 288 that actually was passed out of this last legislative session. This is actually really fun, and I say fun, maybe a little hyperbolically, but also because I'm a nerd and I think this is cool. Education and Mental Health Coordinating Council that was created from this bill, which has some direct purposes that will really allow for this coordinating council to provide guidance to legislative leaders, other state leaders, including us at the division, at USBE, at other partnering agencies who are participating. It has some specifics for individuals who are participating within the group. I believe the group is in the process of forming at this point in time. And this is really exciting because it just allows all of the partners who work within schools and who are doing behavioral health and mental health work to really coordinate and ensure that we're doing the best we can. We recognize that state and other resources are limited. And at this point in time, we have to lift a lot with a little. And if we can do the best we can while coordinating, I think it's going to be the most effective. So I'm excited to see this get going and to see the recommendations and everything that comes out of this group. Next, I'll let Christy talk about School Safety Center.
All right, so School Safety Center was an initiative that came out of House Bill 120 in the 2019 legislative session. And what it did is it created a partnership between these three agencies. So Department of Human Services, USBE, and DPS. And since we have also added University of Utah's Huntsman Mental Health Institute and Safe UT. And so together, we have liaisons that meet weekly and discuss initiatives, priorities, gaps, look at data. That same House bill also allowed us to hire a school safety data analyst, which was very exciting because he looks at not only the physical safety and the emergency preparedness or the drills or the hardening of schools, but also the social connectedness and the mental health data, the school discipline data, looking for disparities in some of those data elements. So it's really been a very cool forming to all come together and sit at the table and a unified purpose of really doing what's best for kids.
We do have a question in the chat right now. I don't know, Jessie, do you want to ask yourself, or I can go ahead and read it as well?
Sure. Hi, everyone. These are amazing slides and you all do great work. So thanks for this presentation. I was just wondering about the coordinating council. how extensive will it be? I wasn't paying enough attention to that bill, and it's making me think, like, will it loop in local mental health authorities? Will it be contracted providers? Like, how extensive do you see this going?
So the coordinating council actually has some specific entities that are written into the bill. So for example, it will include some legislative representatives. It will include participant from our division, most likely Doug Thomas or myself. It'll include at least one individual from USVE. And Christy, I'm not sure if we know who that is at this point, but I assume it's leadership level at that level. And then there's also partnership from private entities, and then the community mental health centers, as well as some other parties. And there's always the option as well that this work will kind of trickle down into some more work group related tasks that will be things that will probably be more overseen at the direct department levels or anything like that. So there's a lot going on within it. And I think it's going to, there's some specifics, but also I think there's the ability for it to evolve as well as it kind of moves forward. I hope that makes sense, Jesse.
Yeah, that does. Thanks, great to see you.
Any other questions at this point, or? Okay, just one thing that I wanted to mention with the School Safety Center that I think is really cool. I think the School Safety Center is such a valuable resource because one of the things that I think we as a society often miss is identifying how to give resources to individuals who are in need. And those individuals who are in need, particularly the ones I'm referring to, are the ones who maybe are the ones who are socially isolating, the ones who are not really participating in other activities, or they might be kind of the quote unquote outcast. They might be an individual who doesn't seem to engage with their peers, or they're not doing well in school. They might be considered, and I put this in quotes, a red flag. There might be issues related to violence or some things like that. And I think it's just really important to ensure that we are doing the best we can to provide resources and doing that work, as opposed to isolating that individual more and taking them out of that system. So I'm really excited that the School Safety Center is available, that it's working, and that it's putting some things together that I think will be really impactful for our state.
Absolutely.
All right, so as we're talking about this, I wanted to also mention to all of you just some things to watch for, whether you have your own kids, whether you are a teacher or someone who works with kids. I think this is just really important information that I always get the questions of, well, what can I do? What can I take away from this directly? So within this, firstly, I'll just say all kids are different. Whether you're talking about a 10-year-old, whether you're talking about a 17-year-old, whether you're talking about a 5-year-old, they all present in very different manners. And I think it's really important to understand that. So as we're talking about things, the first thing that I want to mention, and I know I put this at the bottom, though, because I think it's such an underlying piece. We're looking for a lot of multiple signs of changes and a lot of signs of issue. Kids might not want to talk about what's going on, and that's okay. But one thing that I think we'll see is we often see that they express themselves through their behaviors. So for example, and this might resonate really well with maybe Rebecca who's in the room, but with younger children, if you see some increases in issues related to potty training or to toileting and things like that, or if you see issues related to becoming extremely clingy or maybe not trusting trusted adults as much. There may be some issues related to things like physical health impairments. So like they might complain of stomach aches, or they might have issues with headaches. They might also just have really bad issues with sleeping. Those things are all things that can be addressed as warning signs, especially for younger children. They can also present themselves the same way in older children. It kind of depends on where the child is at developmentally as well. When we're talking about other older children, though, behaviors can also become a little bit more aggressive or outspoken, especially the more verbal and the more the older individuals get. So if you have a teenager maybe and you think they're just being extremely moody, maybe there's something going on. It's never going to hurt to ask, even if they say they don't want to talk about it. I think opening that door and being able to say, I'm here for you if you need to, And that's not just advice for parents, that's advice for anybody who I would consider to be a trusted adult for these kids. I think it's such an important role that a lot of people have privilege to play. And if you have that privilege, I think it's important to watch for those warning signs. And sometimes it just takes a simple question of asking, how are you doing? What's going on? It goes back to what I was saying about the school safety center and making sure that we aren't just labeling them and throwing them to the side. One of the best things we can do as we're trying to make sure kids are doing well is just communicating with them and treating them like they know what is happening in themselves, because we are our own experts. Any questions before I move on? I usually get questions on this one, but if there's not, I'll move on. Okay. The next thing I want to talk about, this is just a really brief rundown of our public mental health system. This doesn't impact any of the private services that are available through other providers, but I just wanted to hit on this since this is part of our purview at the Division of Substance Abuse and Mental Health. So we provide oversight to the 13 community mental health centers, or local mental health authorities, as maybe some of you might have heard of them called. The color coordinating on here is directly related to the catchment areas. So you'll see for some of the bigger, maybe more rural areas, you'll see combined county structures. So the big one, for example, would be Central or Southwest, where you have 5 and 6 counties. The reason for that is just to ensure that there is a provider available within these counties. So for example, in Kane County, if you're from that area, I know for a pretty good fact, it might be a little outdated, but last I checked, there were only 2 mental health clinicians that lived in the Kane County, Panguitch kind of area. And I think it's something that is important to pay attention to, but they also are opening up some services as well. So all of these areas have direct mental health services in varying capacities. I listed just a few of the services here that are available. So individual therapy, family therapy, there's things like parent education, social skills, case management, consultation services. And one thing that's really nice, especially as it relates to House Bill 373 that Christy spoke about earlier, is a lot of these mental health authorities are also working with the local school districts. They've been doing this for a long time, but House Bill 373 really opened up a lot more opportunity to do so. And that's been really beneficial as it's increased the partnerships available. It's increased the number of kids who have been able to access services. And I think overall, it's just really supported our system and our continued access to care. I'll let Christy talk a little bit about this one since it's all about collaboration.
All right, thanks, Eric. So many of our schools, as Eric mentioned, are already in full cahoots with their local partners. So they know their kids, they talk about their kids, they have very strong relationships and a good loop of communication. So they're addressing treatment on the same levels. Adults in their life are repeating the same types of prompts and encouragement that they're getting in treatment. And so I say hurrah for many of our schools that are already well down this path. Some of our schools are starting to build that capacity to be able to step into more of these realms. And as we know, as Eric said, when kids are showing signs of a mental health concern, it's often going to show up in things like academics, behavior, and attendance, tardies, emotional outbursts. So things that sometimes come across as disruptive or unruly, or, oh, they're the hard kid. Really, it's a matter of, what, they didn't take their meds today. And with some teachers, they'll go, oh yeah, I know that kid. And when they're off their meds, watch out. And so just having some of those conversations where there really gets to be an understanding of what's behind the behavior. And that's also part of the conversation around trauma-informed practices and trauma-informed care, is not what's wrong with them, but what happened to them, what's driving that. And so the medication management, that's something that schools don't really step into, but There's trainings to help them understand what their part is in that, to help parents gauge behaviors when they are on or off their meds. School-focused recommendations are a very difficult thing, mostly because schools run 9 months of the year. And so if we're looking at schools as being the only solution to mental health care, that can be a real issue too, because we can't do it alone. We need our partners. Schools can do a lot within the tier 1, tier 2 realm, universal interventions for all students, identification of some targeted needs. And then if there's some really intensive needs, then that's when we really rely on our partners to help us provide the treatment and the care and those wraparound services that our students are needing. So there is quite a bit of collaboration. Part of this too runs within the multidisciplinary teaming. Our school safety center models that multidisciplinary teaming practice. And so when you have multiple professions, again, sitting at the same table to discuss individual student needs, the outcome is always going to be better. And then also, pulling in the parents and linking arms with them and being sure that they have the supports and resources that they need. I do see a question in the chat. So do we want to go ahead? Thanks, Jody.
I gotcha. Joseph, you can ask if you like, or I'm happy to read it. I'll give you just a second. Okay, what is the current state of evidence-based mental health wellness program, good behavior game, which is extremely valuable behavior disorder prevention program for all students?
Yeah, this some of you have heard me talk about this before, but it's extremely valuable. I know the Division of Substance Abuse and Mental Health has, because partly at least because I've stressed it, is initiating this in some schools. Some other school districts have already begun to use it. Huge return on investment, $64 for every taxpayer dollar invested. Anyway, I just wondered how that's going.
So I'll speak to that a little bit, Eric, and then if you want to jump on with your perspective. So schools really have a lot of autonomy in what programs they select, and we encourage that that's done based on the data that they're seeing, which program is best going to address specific needs. And so Good Behavior Game is an example of one of those programs that many of our schools have been using. Our Project Aware Schools, which is the mental health grant that we have in the state, have also been using Good Behavior Game. And so I think just one, schools have the autonomy, LEAs have the autonomy to select that. And then two, however the services are identified by the schools, and then how they're funded is really site-based. And so I'll let Eric kind of pick up from there.
So the only thing that I'll add to that is that within that local autonomy is also the ability to really work closely with, in this case, it would be the prevention teams and prevention coordinators within the local authority system. It's really a benefit to have those partnerships, and I think it's another substructure of the ways that we work together. So I appreciate the question, because it really highlights this idea that service and support for kids isn't just about direct treatment, it's also about the prevention side of things. So we're looking at things like the Good Behavior Game. There's also a number of other things like BOTVINs, for example, is another evidence-based tool that's being utilized. And there's a number of these kind of evidence-based programming. And that's really, I think, an important aspect. And actually, I think it gets to the next slide where we'll talk a little bit about some of the just evidence-based needs that we have as a system, and really how we need to kind of continue to go forward in that direction.
Yeah, I think that actually it has a therapeutic value for those who are struggling, of course, also. So yeah, I was first introduced to this several years ago at a Medicare or Medicaid conference, and was amazed at how the $64 return for every dollar invested compared to the next best one, which was like $16 for every dollar invested. Just tremendous benefit for the investment. Thank you.
Yeah, thank you. Thank you. All right. So anything you want to add on that slide, Eric? I'm assuming no, since you switched already.
No, yeah, sorry. I think you covered it very, very nicely.
Perfect. All right. Yeah, so thank you, Joseph. This really kind of segues into our next slide, which is the best practices in the programs. And so there are quite a few programs out there. Some that will just kind of pop out there would be your Mindful Schools, which is also evidence-based. It has online trainings. Mental health first aid, youth mental health first aid. Again, just another fabulous one for helping all stakeholders understand signs and symptoms of a mental health concern, and then being that help that may be needed. Telehealth services, trauma-informed practices, there's a lot of trainings available. In fact, we'll talk a little bit about the ones that are offered through USBE. The SafeUT app, here's my 5-second pitch on that. I know you're all a fan and very knowledgeable, but I would encourage you just in your conversations in your community and in your social circles, make sure people know that that's available to them. Be that little reminder that's like, hey, you know, if you're on suicide watch, you're really concerned about somebody, this is available to you and nobody knows who you are. It's 100% confidential. And so, and Eric's going to speak just a little bit about crisis services. Oh, okay. I see.
Yeah, there is a new question. If we want to get there before Eric,
yeah,
where can we get training on mental health wellness first aid?
So,
and Laurie, if you would like to unmute, you can ask as well and follow up on your question.
Give you a second to unmute if you want to say anything else. So mental health first aid and youth mental health first aid, if you just Google that, yeah, thanks, Laurie, you would be able to just see what the curriculum's about, what's involved, how to become a trainer, all of those things that are online. But if you're interested in a training, please reach out to me. I'll get you connected. We have several trainers. I'm sure Eric can speak to the same. There's partners that have trainers and trainings across the state. And so very happy to help you get that going. I love that program. I'm going to be totally biased right there. I love youth mental health first aid.
I'll echo the bias and say it's a great program. I will also echo what Christy said. I think throughout the state, especially with the suicide prevention efforts, we've really focused on bringing these types of trainings throughout the state. So there are not only individuals who are trained as trainers across the state and multiple systems, health, human services, education, but there's also individuals just at local levels as well who might be in private providers and others like that. So definitely reach out to either of us and we can connect you. Or if you might have a community partner that you know of or that you've heard of doing this, that's also another great recommendation as well. So it's a great program. The other thing that I'll also mention kind of in tandem with that is just QPR is also another beneficial suicide prevention related training. Those are also available across the state. And I think they're kind of in similar vein as mental health first aid. And it's just important as we're trying to spread the word and make sure we're doing a lot to address the suicide prevention efforts of our state.
Okay, thanks, Eric. That's all I have on that slide.
Perfect. Back to you, Christy.
Oh, okay, wonderful. So with the trauma-informed practices, this is something that was set up in legislation. So schools that are taking advantage of certain funding sources actually have to go through trauma-informed practices trainings. And so this slide outlines some of those trainings. One thing I do want to point out here is the ACEs and Handle with Care. So Handle with Care is the best practices. It's not necessarily a program, but literally a practice. in which multiple community partners get together, and it's almost like a secret code. So if you have a law enforcement officer that responds to the home of a child who is involved in the public school system, then they can communicate to the school staff, handle with care. So this student, handle with care. And so when I say secret code, that's really what it is, because oftentimes there's an investigation, or it's sensitive, it's confidential, and that student may have experienced trauma the night before. But as we know, a lot of students, no matter how bad the day was before, they might have had a death in the family, they might have seen dad arrested and hauled off to jail. They'll come to school because that's comfortable, that's what they know, that's stable. And so being able to communicate that, handle with care for that student, and just know it might be kind of a rough day. So get with the kid, make sure that they've eaten, make sure, hey, how you doing today? Just make sure you're touching base so that they feel that extra support and can open up if they need to. Also, on the USBE website, you can access all of these different trauma-informed modules. And so that is open to anybody. So it is not just for educators. So if you're interested, if you'd like to participate and go through those trainings, they're very well done. They were done as a collaborative project. So multiple stakeholders, lots of content developers. And so I would encourage you to go ahead and check those out as well. Eric, anything you'd like to add?
I don't think so. I think I will just add, I guess, one quick thing with Handle with Care, just so you're all aware, we're actually in the process of ensuring too that we, although it is kind of a practice, it is something that we feel that also needs to have some at least education about it. And we're trying to develop some of that education. I mean, literally we've been working on this recently. So this is something that we're really excited about. It's a small, simple thing, but those 3 words can really mean a lot. It's seen some really great success in other states who have done it. So we're just in the process of ensuring that we're taking some of the lessons learned from other states and applying it to what will work best here. So.
Thank you.
All right, so this is just a little bit on telehealth. And I really wanted to highlight this because of the fact that we are currently utilizing a telecommunication method, and it's not ideal, and everybody's sick of it at this point in time. However, I'm a huge proponent of telehealth as a service provision. I think telehealth has been something that, quite frankly, has scared or maybe made behavioral health professionals uncomfortable for various reasons. And I think this last year, if anything positive has come out of it, it's the fact that behavioral health and other healthcare providers have really had to start looking at how this works within their practices and for the populations they serve. Well, I won't pretend that telehealth works for everybody. I will say it is definitely an aspect of the service continuum that should be available to people who are in need and desire it. I'm very passionate about this as well because I think it's a tool in people's tool belts, and we often forget that just because something works for someone doesn't mean it works for everybody, and vice versa. We actually had a small pilot that we were working on with a couple school districts and a couple of our local mental health authorities. And within that project, we saw some pretty positive results. But the thing on this that's really interesting, if you look in the little corner on the table, this is just the COVID impact for our behavioral healthcare system. So we went from serving 118 people during the state fiscal year of 2019 to 8,777 kids. And that was just a large increase. And it was this pivot that our public mental health system had to make in order to serve kids in their communities and in their homes, to ensure that obviously they were abiding by COVID protocol and some of those other initiatives and needs. The other thing that I think is just really awesome, and it's something I like to highlight, there's a lot of cost savings that can be explored with telehealth as well. Oftentimes, especially in rural communities throughout Utah, it can take upwards of 2 to 3 hours in some communities to travel. And that's cost for the clinician, but more importantly, it's cost for the individual who has to go. So if I'm a parent and I live, let's say I live in, my mind just went like Blanding. Let's say I live in Blanding, Utah. It might be hard for me to get services directly where I'm at, or I might have to travel for other reasons. And if that's the case, what about having the ability to just log into a computer and be able to do what we're all doing right now? I wish I could also say, the one thing I will say as a caveat is internet is not always the most reliable. I think we all are aware of that at this point in time. I would also just say that I think internet is a basic entitlement that people need now. I hope that the pandemic has showcased that really well. But realistically, no matter what, it really is a cost saving for people. It's a time saver for people. It's also just an ability to really serve people in their communities where they're at, which is really the name of the game. If you're trying to make access to services easier, there's no better way to do it than to provide it where they want to provide it or have it provided. Is that okay?
Not
I just
a
saw
question,
Rebecca.
just a
Okay.
comment of thank you for sharing the numbers. Review of Telehealth 2020 virtual technology has made all the difference for children and families in many cases. We are under 10 minutes, just to kind of give you an update on your time.
Okay, I'll go really quickly on this. We're only, I think, the last 2 slides anyway. So, some crisis services. So Christy already mentioned a little bit about the Safe UT app. I also wanted to mention the stabilization and mobile response services. These aren't fully available throughout the state yet. However, we're in the process of getting these services rolled out across the state. Right now, the last 2 areas that we're really focusing on are going to be our eastern region. So the Daggett, Duchesne, Uinta, San Juan, that area of the state. And then we're also we're in the process of also putting together some stuff to roll out this service in the Utah County area. We've recently gotten some funding through grants and through legislative efforts to really connect this. And this is just a way to really have crisis and mobile crisis services that are specifically available for some youth needs that are a little bit different maybe from traditional adult needs. It really helps as a way to connect to some local services, some local resources, create some safety plans to connect to families, to really teach the family and to work with the family. And I think that's the key, is that we're working with them as opposed to working for them or anything like that. Christy, is there anything else you wanted to say about the Safe UT app?
No, love Safe UT. Tell your friends.
Perfect. I think that's something hopefully we can all agree on. This is just it looks messy, but it's a rundown of the different crisis services outside of the SMR services, stabilization and mobile response services throughout the state. So the reason that I listed this is it just showcases everything kind of available, ranging from the assertive community treatment, so ACT teams, which are adult focused, all the way through youth service centers, which tend to be more juvenile justice focused. However, they are also available in service kids who are not justice oriented as well. So there's things across the state. There's also a lot of effort to move crisis services in the future. As you can see, we've listed the crisis line, the suicide prevention lifeline, and then the warm line. And one thing that's not listed on here, but it's in the process of moving forward. There was some federal legislation in the past, I want to say 2 years, might be a year, regarding the number 988. That'll be something that I think you'll all start to hear a lot more and more about. It's something that is being actively worked on through, I'm sure, a number of partners who are actively on this call, as well as through our division, as well as through others throughout the state. This is such a benefit. 988 will act basically as a behavioral health crisis line for individuals who are seeking a crisis emergency, but don't necessarily want to contact 911. It'll also, I think, help with resources and resource management as well. And realistically, just having the normalization of a behavioral health crisis that someone identifies and defines on their own is very important, and it can really be the difference between saving someone's life and someone unfortunately dying by suicide. So the last thing that we just wanted to throw up is these are just different resources. The So we have a COVID-19 stress line Utah Strong project that is still available. We actually have been working on this since the beginning and inception of COVID. This is something that we're very proud of. It's a lot of work, and we've worked on it in partnership with FEMA and SAMHSA. There's obviously the Utah Crisis Line, the actual number. So the actual national number will go to the Utah Crisis Line. There's the Safe Fam line that I discussed a little earlier. Safe UT is the app. 211, which has an app as well as some other additional ways to receive services. And then the last thing on here is My Strength. This is actually something through the Division of Substance Abuse and Mental Health we have purchased access for the people of Utah. We have a link on our website, and I can put that into the chat. And within the presentation slides, I will make sure to get them to, I assume Sarah, but I'm not sure who. But we'll make sure to be able to get these slides out. But with My Strength, it's really nice. It's just kind of a tool to utilize for individuals who might not need full therapeutic resources. And even if they do need full therapeutic resources, it's helpful as an additional tool that has evidence-based tips and practices for yourself. And it ranges from things related to substance use issues, depression, anxiety, et cetera. And it's something that we embedded fairly heavily at the Division of Substance Abuse and Mental Health.
I do see there's a question about a copy of the slides, and Eric, I know you just mentioned that we'd get them out at some point. We are recording this session. I hit record a minute late, sorry. There's my, I get like maybe a solid C as moderator today now. We were still on the first slide, just missed my part of introducing our wonderful speakers today. So there will be a recording available. Sarah Hodson will get that out at some point. I'm not sure if there'll also be slides or if there's ability for that. I know she's creating like a Dropbox. So hopefully that helps you, but I would guess that if you emailed either of these two wonderful people, they could just get them to you. And you can tell me if I'm wrong. And then any idea when Safe UT, Safe and Safe Fam might be available in, in Millard? What can we do in our county to bring some of the services in the last slide to the county?
So I can speak to Safe UT real quick. Oh, really quick. So
we have 1 minute.
So Safe UT is already available. It's a statewide app. It's a free download. And so if you also email me, then I can get you in contact with Safe UT and they can send swag. They can come out and do assemblies. They can help you promote that.
And I put Christy's email in the chat. Eric, I don't just have yours handy. Will you type your own? Christy and I work in the same agency, so hers just like comes up for me. Thank you, Eric.
Yeah, you're welcome. And in regard to Safe Fam, although we aren't, I don't know the exact rollout for Millard, but I will say that when it comes to crisis services, the standard crisis line will also be available. It's currently available to use in Millard. So if you call that line, it is accessible. And I'm sorry if you can hear my dogs. I don't know.
Like that, but
they're all ending, so everyone's coming.